So now if you're living on the couch and living in chronic pain like I did for over 7 years, having fibromyalgia and chronic fatigue, I want to show you some stuff that even you can do on the couch or in your bed. All right. So one is, if I was laying down, it would be similar to this, where I'm going to take my rib and my hip and try to squeeze them together. And then I'm going to go to the other side. So I'm going to be exaggerated when I'm doing this. When I'm actually doing it, it looks like this. And what that's doing is that's kind of contracting and releasing some of the hip muscles as well as the glutes, and it's going to help loosen up the low back. So that's one you can do. Another one is called, like a pelvic, almost like a thrust. And so if I was standing up and did that, you would almost see me look like Elvis, where I'm kind of tilting my sacrum forward and back. But so I'm going to turn slightly sideways so you can kind of see me. And it's almost as if I'm doing that. Scooping my pelvis forward and back, scooping back and forward. So between the hip hikes, they call them, and the pelvic almost thrusting maneuver, you can get a lot of release to the low back and some of your low back pain that can be deep and intrinsic muscles of the spine. My recommendation is that you do 10 to 15 of the hip hikes, either one-sided or go back and forth more ideally. And then, of course, about 10 to 15 of the pelvic thrusts. And then maybe later that day, do them again, do another round. That'll really release and strengthen your low back.